Hello and welcome. I want to make a video about some recent surprising health news that was released about our former President Joe Biden. He was diagnosed with an aggressive form of prostate cancer, and many people are trying to figure out how this was not discovered first. And I actually have a life experience that I'm going to tell you about that might help people understand why this diagnosis may have not came sooner. There are people out there that believe that it was known about either during his presidency or before, and it was covered up. I don't fully believe that because they would have started treatment, and he has not been under treatment. So I'm going to step back in time to when I was a child. Where my mother worked, she became friends with a coworker. We got to know her coworker and his family. Years later, when I was an adult, he needed to have his shoulder operated on that would then require physical therapy after the surgery. Sadly, even with all the testing that they'd done before the surgery, it was during the end of the physical therapy when he was still having shoulder pain that the doctors looked further and they found a nodule in the top of his lung that turned out to be stage 4 lung cancer. And about all that they could do at that time was keep him comfortable. So that should be proof, because this was 2013, 2014. So not more than about 12 years ago. That even with how good our medical system has become, there are still conditions that can elude us. Back to former President Joe Biden. I know some people completely disagree with his politics. I am not political. However, this man is human, and he has a family that cares and loves for him very much. And this man did so much over his career to help advance what we know about cancer and treating it, that I can't help but feel like I need to help people understand. On May 18th, Biden's personal office disclosed that he had a Gleason score of 9. A 9 is high. The highest 3 scores you can have on a Gleason is 8, 9, and 10. The cancer cells look different from healthy cells. And grade 5 is the most advanced stage where cells look very abnormal. People are probably wondering, the PSA test. Where was it? If he had it, why didn't it show it? Well, just like the person I told you about, whose stage 4 lung cancer had hid, there is a very good chance that while Mr. Biden was in office, the PSA tests were being conducted. And honestly, we have HIPAA for a reason. And Biden should not have to completely reveal his medical history to everyone. The PSA tests are not foolproof. Our body has ways of coping with things to make testing look normal. It was through the in-person physical exam that the nodule was found, and they discovered from further testings that it had spread to the bone. His prostate cancer is hormone sensitive. This means they can put him on medication to lower his testosterone to control the spread. Remember, it has already spread to the bone. And from the research I have done, my understanding is surgery is not likely to be a treatment option that they are going to seriously consider at this point, because it has spread to the bone. He has had a care team the entire presidency that was doing annual physicals on him. But again, HIPAA. So let's respect that. Prostate cancer is usually slow growing. Men over 70 are not recommended for routine screening like the PSA. So again, there's a chance that maybe he didn't even get screened. My understanding is he will be receiving some of the best medical care that is to be offered in the nation. There is at least 3 or 4 different treatment options that his family is reviewing. Apparently, there are some results from annual physicals that were released during Mr. Biden's presidency from 2021 to 2025, but they do not mention any information about PSA screenings. Some aggressive forms of prostate cancer yield normal PSA test results. In such cases, cancer may be diagnosed via rectal exam or MIR. And I believe it was the rectal exam that the nodule was discovered. While his prognosis is more severe for a tumor that has spread, there are still treatment options available, and his future is hard to predict, especially without knowing details about his tumor and how he will be treated for this. Just how dangerous is prostate cancer? Well, it follows skin cancer, and it is most common in American men. It is more likely as you get older with age. Black men are more likely than white men to receive prostate cancer and the diagnosis. And unfortunately, the black men are twice as likely to die from this chronic disease. Cancer is a chronic disease. There is an estimated 3.5 million men living with prostate cancer in the United States in 2022. For most men, prostate cancer is a slow-growing tumor that can be monitored without treatment. When caught early, doctors often recommend active surveillance, meaning monitoring the tumor for signs of growth, but not immediately treating the cancer that might never turn dangerous. Only about 2% of men die within 5 years of a prostate cancer diagnosis. In cases such as Mr. Biden's, when the cancer is aggressive, some older patients have significant risk of dying from prostate cancer. For cancer that has metastasized, that means it has left the original tumor and spread. The median 5-year survival rate is only around 38%. While those numbers represent the overall population, patients can survive longer. The prognosis from this point is very much dependent on really how much cancer is actually outside his prostate, as well as how he responds to treatment. There have been tremendous advancements in the treatment of prostate cancer, even after it has spread to the bone, such as the people living for years and years with particular diagnoses. What types of treatment could Mr. Biden receive? Men with prostate cancer that have had the cancer spread can get hormonal-based treatments to fight the disease. Even though everything sounds bad, when a patient is diagnosed with aggressive prostate cancer that has spread, a combination of therapies, including hormone treatments, can be especially potent and durable. What that means is it's not going to necessarily put their cancer into remission, but it is definitely going to prolong their life, and it may not be the prostate cancer that at the end they die from. Like I said, the doctors might try to lower his testosterone levels. There are also newer drugs that target the testosterone apparatus in the cancer itself. That means the medication pretty much goes into the cancerous cells and prevents them from being able to use that testosterone. Other treatments that Mr. Biden could receive would be radiation or chemotherapy, possibly both. It all depends on how far his cancer has spread and his overall health. Debate over the PSA screening. The role of screening for prostate cancer has been debated for years amid changes in guidelines. They've actually several times said, okay, you need to test all men over a certain age. And then they've gone through and they said, okay, we think you only need a test in this age group. And currently, men over 70, it's not something that they test for in annual exams, especially if in years prior there was no indication that the testing should resume. The number of prostate cancers diagnosed each year has declined from 2007 to 2014, which is part of the reason in the changes in the screening. And since 2014, the diagnosis rate has increased 3% by year. Currently, the U.S. Preventative Service Task recommends that men aged 55 to 69 at typical risk decide whether to screen for prostate cancer with a PSA test. Men should discuss this with a doctor. The potential benefits and harms of screening before taking a PSA test. Benefits can include detecting potential dangerous cases earlier. When the less aggressive screening guidelines was implemented last decade, studies show men were being diagnosed later and with more advanced stages. Screening also brings potential harms. Risks can include detecting cancers that aren't deadly, unnecessary biopsies, or treatments and procedures, side effects, or anxiety. Doctors believe the task force recommendations on PSA screening misses the mark. So that is my saying that I have on Mr. Biden for his diagnosis, and I wish the best for him and his family in this difficult time. I watched one of my close family members when I was a child suffer through cancer treatment and sadly did not survive. So I am really putting my thoughts and my well wishes out there to Mr. Biden and his family, his friends, and all of the people that love him. And I wish him only the best. If you would like to reduce your risk for cancer, please subscribe to my channel, because I am in the process of explaining to you why each food on my first video I brought to you can help you reduce your risk for chronic illness, including cancer. And we have so much in our environment that if we don't try to eat healthy, we will get bad news too. Bad news we don't want. Thank you so much for watching, and I will see you next time. Have a wonderful day. Be safe, and thank you.